Hey everyone, and welcome back to the channel. I'm Joshua, and today we're diving into the upper limb anatomy challenge. We have 10 interactive multiple choice questions lined up for you. Each question will focus on a different aspect of upper limb anatomy, from bones and muscles to nerves and blood vessels. Let's dive in and tackle the upper limb anatomy challenge together. Alright, let's kick things off with our very first question. Question 1. What bone is commonly known as the collarbone? Is it A, the scapula, B, the humerus, C, the clavicle, or D, the sternum? The correct answer is C, the clavicle. The clavicle is indeed the bone we commonly refer to as the collarbone. Great start, everyone. Let's move on to the next one. Now for question 2, we're shifting our focus to the nerves of the forearm. Which nerve innervates the majority of the muscles in the anterior compartment of the forearm? Your options are A, the ulnar nerve, B, the radial nerve, C, the median nerve, or D, the musculocutaneous nerve. If you chose C, the median nerve, you are absolutely correct. Well done if you got that. Let's move on to question 3, which deals with the rotator cuff muscles. What is the primary function of the rotator cuff muscles? Is it A, powerful arm abduction, B, stabilizing the glenohumeral joint, C, elbow flexion, or D, wrist extension? The correct answer is B, stabilizing the glenohumeral joint. Without a healthy rotator cuff, your shoulder wouldn't be able to perform its wide array of movements smoothly and safely. Question 4. The biceps brachii muscle inserts on which bony structure? Your options are A, the olecranon process of the ulna, B, the coracoid process of the scapula, C, the radial tuberosity, or D, the deltoid tuberosity of the humerus. The biceps brachii is located in the anterior compartment of the upper arm. If you selected C, the radial tuberosity, you're spot on. The main tendon of the biceps brachii inserts onto the radial tuberosity, so that attachment on the radius is key for the biceps' powerful supinating action. Question 5. Which artery is the continuation of the axillary artery after it passes the lower border of the teres major muscle? Your options are A, the subclavian artery, B, the brachial artery, C, the radial artery, or D, the ulnar artery. The axillary artery is the major artery supplying the axilla region and the shoulder. The correct answer is B, the brachial artery. After the axillary artery passes the inferior border of the teres major muscle, it becomes the brachial artery. Understanding these transitions is vital for assessing blood flow in the upper limb. Question 6. Which muscle is primarily responsible for abduction of the arm at the shoulder? Your options are A, the pectoralis major, B, the latissimus dorsi, C, the deltoid, or D, the supraspinatus. The correct answer here is C, the deltoid muscle. Specifically, the middle fibers of the deltoid are the prime movers for arm abduction. The pectoralis major is a powerful adductor and flexor of the arm, so if you're raising your hand in class, you're giving your deltoid a good workout. Question 7. What structures pass through the carpal tunnel along with the median nerve? Your options are A, the ulnar artery and ulnar nerve, B, flexor tendons of the fingers and thumb, C, the radial nerve, or D, extensor tendons of the fingers. The carpal tunnel is a narrow, rigid canal formed by the carpal bones and the transverse carpal ligament. The correct answer is B, flexor tendons of the fingers and thumb. Specifically, 9 flexor tendons pass through the carpal tunnel, so it's the median nerve and these 9 flexor tendons packed into that small space. Question 8. What is the most commonly fractured bone in the upper limb? Is it A, the humerus, B, the radius, C, the ulna, or D, the clavicle? The correct answer is D, the clavicle. The collarbone holds the title of being the most commonly fractured bone in the upper limb. It usually heals well, but it's a memorable injury for anyone who's experienced it. Question 9. The radial nerve primarily supplies which compartment of the arm? Is it A, the anterior compartment, B, the posterior compartment, C, the medial compartment, or D, the lateral compartment? The correct answer is B, the posterior compartment. The radial nerve is the workhorse for the extensor muscles of the upper limb in the arm. It innervates the triceps, brachii, and other smaller muscles in the posterior compartment. Damage to the radial nerve can lead to wrist drop because it also supplies the extensor muscles of the forearm. Question 10. Which joint directly connects the upper limb to the axial skeleton? Your options are A, the glenohumeral joint, B, the acromioclavicular joint, C, the sternoclavicular joint, or D, the scapulothoracic articulation. The correct answer is C, the sternoclavicular joint. This joint is the only true synovial joint directly linking the appendicular skeleton of the upper limb to the axial skeleton. It's a saddle-type joint that allows for a surprising amount of movement. The strength and stability of this joint are critical for transmitting forces from the upper limb to the trunk. And that's a wrap! Congratulations on completing the Upper Limb Anatomy Challenge. Whether you aced all 10 questions or learned a few new things along the way, I hope you found it both challenging and enjoyable. The human upper limb is such an incredibly complex and versatile part of our anatomy, and understanding its structure is fundamental to appreciating how we interact with the world. Thank you so much for taking the time to test your knowledge with me today. I truly believe that learning anatomy can be an engaging and rewarding experience. If you enjoyed this quiz and want to see more content like this, please make sure to hit that subscribe button and turn on notifications so you don't miss out on future anatomy quizzes and medical topics we'll be exploring here on Medical Quiz Zone. Your support means the world and helps the channel grow, allowing us to create more educational content for everyone. Feel free to share your score or any aha moments you had in the comments below. I'd love to hear from you. Thanks again for watching, for participating, and for your curiosity. Keep learning, stay curious, and I look forward to seeing you in the next video.